Before we begin, I would like to update you on 2 upcoming changes to our public reporting. First, today is the last day of school for most school boards in the province. This means that as students break for summer, so too will our school outbreak map. The school map will be removed from the website on Friday. Any outbreaks identified in summer schools will be investigated the same as all other outbreaks. Second, we are also adjusting how we calculate the percentage of Albertans who have received the vaccine. So far, we have been using Alberta Health's 2021 population data to determine what % of people in a particular area have received 1 or both doses. However, the Public Health Agency of Canada and most other provinces and territories are using Statistics Canada's July 2020 data for the denominator. To bring our numbers in line and to allow for appropriate comparisons across the country, we will now be using the July 2020 Statistics Canada data as well. This means that as of today, 72.7% of eligible Albertans have now gotten at least 1 dose, and 40.7% are fully immunized. It also means that the percentages in most regions will increase slightly due to this new denominator. This does not change the fact that every dose matters, and I am asking everyone to get fully immunized as soon as possible to help protect our communities. Turning to today's update. Over the last 24 hours, we identified 61 new cases and completed about 3,400 tests. Our positivity rate was about 1.6%. 16 more variant cases have been identified over the last 24 hours. There are alerts or outbreaks in 130 schools, which represents about 5% of schools in the province. Currently, 170 people are being treated for COVID-19 in hospital, including 36 admitted to the ICU. Across the board, our numbers are moving in the right direction. Cases, hospitalizations, ICU admissions, and our positivity rate are the lowest they've been since last summer and early fall. Right now, there are only 5 active cases in all the continuing care facilities in Alberta combined. That is a remarkable number. Earlier today, I participated in the first of 3 town halls to hear from residents, family members, staff, and operators of these facilities. We are getting their input on how this dramatic impact of vaccines should inform what health measures are necessary in these settings and for how long. There are now 1,132 active cases in Alberta, the fewest since August 26th. We should all be proud of these numbers and take heart in them. Opportunity is knocking. If we all keep making wise choices and more people get vaccinated, active cases could fall below 500 in a few short weeks. Sadly, I must also announce that 4 new deaths were reported to Alberta Health in the last 24 hours. My thoughts go to the family and friends of these individuals. I know the absences of those we've lost to any cause during the pandemic continue to be felt. I want to extend my deepest condolences for your loss. It is to prevent outcomes like this that immunization is so important. I know there have been some questions lately about reports of side effects from Pfizer and Moderna vaccines, so I want to provide some information on what we know about heart muscle inflammation after immunization. From Israel and from the United States, we have seen reports of a rare side effect of heart muscle and heart lining inflammation after Pfizer and Moderna vaccines, most often after the 2nd dose, and almost always very mild. This side effect is being seen most often in younger people, mostly males. In Canada and in the United Kingdom, we have not seen the same trends, possibly due to the fact that 2nd doses in younger people have not yet been given in large numbers. However, given what has been reported in other countries, here is what younger Albertans should know about this condition. First of all, young people who get infected with COVID-19 have about 100 times greater risk of experiencing heart inflammation than what is being seen after the second dose in Israel and the US. Second, the heart inflammation reported after the second dose is almost always very mild, resolving with anti-inflammatory treatment. Finally, in both countries where it has been reported most often, after rigorous review of all the evidence, advisory bodies in both countries have concluded that the benefit of immunization far outweighs the risks. We discussed this topic last week with our Alberta Advisory Committee on Immunization, and they agreed. We will be putting together more detailed information on our website to help provide the most up-to-date data to inform decisions. But I continue to recommend that all Albertans 12 and older get the vaccine, first and second doses, to be protected. As this is my last regularly scheduled media availability, I want to talk a bit about what comes next for us as we enter stage 3. We are on the cusp of not only removing many restrictions, but also opening up our social circles, businesses, and personal lives. Of course, while cases are dropping and spread is declining, COVID-19 is not going away completely. It remains a potentially serious illness that we must keep respecting. As we move into stage 3, we will continue to offer testing to everyone with symptoms as we monitor the impact of changes. This is just a reminder that if you feel even a little bit unwell, it remains critical for you to stay home and arrange to get tested. We will also continue to actively investigate and contact trace new cases, as well as screen for variants. Health officials will continue investigating outbreaks and taking whatever steps are needed to protect the public's health. Masking will continue for all staff, physicians, and visitors at AHS and Covenant facilities. This includes acute care, continuing care, and community sites, including COVID-19 testing, immunization clinics, and community labs. Visitation at AHS acute care sites will remain unchanged until July 5th, when 2 designated support persons will be able to visit a patient at one time. We will keep robust measures in place in order to watch closely to see what impact stage 3 may have. However, we have seen the power of vaccines. They drastically reduce the chance of catching this virus and, if people are exposed, of them experiencing severe outcomes like hospitalization. Since January, more than 95% of cases have been in those who weren't vaccinated at all, or in those who hadn't yet developed immunity from the first dose. More than 92% of hospitalizations during that time were also not vaccinated or within 2 weeks of their first dose. Vaccines are safe, and they drastically reduce our chances of becoming severely ill. The #1 best thing we can do to protect ourselves, those around us, and to keep Alberta open is to sign up, show up, and follow up for both doses of vaccine. I know there are questions about kids under 12 who aren't yet able to receive vaccine and how to keep them safe. This is also a highly personal question for me, as my children are under 12. We know that vaccine trials are underway in younger age groups, but we don't yet know when vaccines will be available for younger children. In the meantime, the advice I would offer for others in this situation is first of all to encourage all adults and older children in their lives to get immunized. This is the most important thing that we can do. The second is to be intentional about thinking about not just risks, but also benefits of activities. We need to consider the benefits of activities for each child based on their context. COVID-19 risks can be mitigated, for example, by choosing outdoor activities over indoor activities and having fewer close contacts compared with many close contacts. All of us will need to make decisions in the next several months about how we weigh COVID-19 risks against the benefits of different options for us and for our children. Kids under 12 have the lowest risk of severe outcomes from COVID-19, and this fact is one we need to incorporate into our deliberations. Each family will need to make the decisions that are right for them, There is no one single perfect answer. Another question we have received is about vaccines that may be expiring soon. Since the beginning of our response, we have been carefully managing our inventory to avoid having any doses expire. Unfortunately, due to decreased demand in recent weeks, we do have 4,532 doses of AstraZeneca that are due to expire on July 1st. This is a small number, considering that more than 289,000 doses of AstraZeneca vaccine have already been administered, and the vaccine wastage remains very low compared to other immunization programs. However, if you are booked to receive a first or second dose of AstraZeneca vaccine, please reschedule your appointment to prior to July 1st so that as few doses go to waste as possible. Thankfully, these doses are the first to expire from more than 4 million doses administered, and the remaining inventory will not expire for many more months. This is also a reminder that with vaccines, every day counts. It's important that we all get fully immunized as soon as we can. As I said, this is my last regularly scheduled availability, which means it's the last time that I'll be talking with you for a while. It has been a tremendous privilege to support Albertans over the last 16 months and to help keep you informed. This pandemic has tested us, and at times it has polarized us. It has challenged all of us in ways that we never could have expected. But it has also made clear one indisputable fact. We are stronger and safer together. We are a province of people who protect each other, who support each other, and who rely on each other in a million different ways, big and small. So please keep supporting each other in the days ahead. That means getting vaccinated as soon as you can and helping to combat vaccine misinformation whenever you see it. It also means making safe choices when we enter stage 3, not because there is an order directing it, but because it is the right thing to do. Staying home when sick, getting tested, and supporting others who need to keep taking precautions for a little while longer will help keep you and everyone else safer. There will be challenges in the months ahead. We will still identify new cases and outbreaks will emerge, but we are watching closely, ready to act as needed. And I am confident that we will get through this, as we always have, together. Thank you, and I'm happy to take questions.
All right, we'll open the floor to questions. We will begin in the room here with Julia Wong from Global News.
Hi, Dr. Hinshaw. Very good to see you again. You spoke a little bit about younger Albertans earlier, but I'm hoping for more specifics about some do's and don'ts as we approach reopening. What should they do after Thursday? Can they visit their grandparents? Are there situations where they need to take more precautions because they are unvaccinated?
Thanks, Julia. Good to see you as well. It's really difficult to have a list of do's and don'ts that will apply for every single situation. As I said, this is a personal question, as my family and I need to make those decisions for our own children. What is important to know is that, of course, this particular group of kids who are under 12 don't have access to that protection that vaccine offers. At the same time, we know that those children are less likely to have severe outcomes from COVID-19. We know that although there is a lower risk of younger kids transmitting to others, that risk is not zero, so kids can still pass it on. And ultimately, again, each family is going to need to navigate those kinds of situations to determine the kinds of risks that are appropriate for their context. That very common question, can my young children hug their grandparents, again, is up to a conversation between the grandparents, the parents, the kids, and how those kinds of situations can be managed. And there's no one single right answer for everyone. Our risks are dramatically reduced if all adults and older children in those younger children's lives have been vaccinated. And so again, this comes to the kinds of decisions that we used to make every day about other risks without thinking twice. But COVID-19 has been such a dominant force in our lives for so long, it's easy to forget that we have always navigated risk, and we've always had to make those decisions about our values, our context, our risk factors, and this is just making it a bit more explicit. But again, there's no single right answer for everyone.
Follow-up, Julia?
Thank you. On a slightly different topic, last year you promised race-based data would be released. We've been asking for sector-specific transmission data since the start of 2021. Case numbers have gone down dramatically, more people are getting vaccinated. So will you commit to releasing these data sets, and if so, when?
Thank you. Great question. With respect to the both race-based and the data on sector-specific transmission, we have over the past year done work to prepare that analysis, but unfortunately between the second and then the third wave, we've had to shift our analytics team's focus at different times and haven't been able to complete those for public release. So absolutely will look into that. Unfortunately, again, just need to be able to have conversations with the team and understand timelines, so I'm not able to determine exactly when, but we'll absolutely take that back and have those conversations.
All right, we'll go to the next question in the queue. Lauren Boothby, Edmonton Journal.
Hi, Dr. Hinshaw. I have a similar question. So nearly all restrictions are being lifted in just 2 days, but that sector-specific data hasn't been released yet. That shows how COVID spreads in different circumstances, like, say, at a movie theater, eating in a restaurant, shopping, schools. So how can Albertans feel comfortable getting back to normal if we don't know which activities in particular are most risky? And what can you tell us? I know you don't have the whole data set done, but what can you tell us?
Thank you. We know not just from our own data and the preliminary work that we've done, but we know from examples around the world what the riskiest situations are, which are where there are many people together in a closed indoor space that is poorly ventilated, and people are engaging in activities where they're perhaps speaking loudly, singing, engaging in activities where they may be producing more droplets and more infectious particles. Those are the kinds of factors that make a particular environment more risky. So in some ways it's less about an activity like shopping and more about what that particular location looks like, how many other people are present, is it a crowded indoor environment? And so if people are wondering how to navigate risks, it's best to think about going back to avoiding closed spaces, avoiding crowded places, and close contact with multiple other people. If you have high risks, if you're wanting to reduce your risk over the coming weeks and months as we all navigate our way back into what does this next phase look like for us. And so again, those are the kinds of things that are consistent across multiple studies, across observational data releases, are the kinds of factors that make an environment higher versus lower risk. And so again, those are the kinds of things that people need to keep in mind as they're considering what activities they are going to participate in.
Lauren, follow up?
Yeah, thank you. I just got my second dose last week, and my protection still won't have kicked in by July 1st when most restrictions lift. And I've had the privilege of being really in the know about COVID because I'm reporting on it, but there's still a lot of people who haven't had one or both vaccines. So what about those communities with lower vaccination rates, particularly any vulnerable communities? Have we given them enough time to get that information, to get vaccinated? And what kind of message does it send to them about how valuable they are and their safety if we're lifting restrictions without a considerable number of Albertans being protected? And as well, municipalities are lifting their own restrictions, looking at your own recommendations. So how do we know that these recommendations are how we should go about it?
It's a really important question of balance as we're looking at the kinds of things that we keep in place versus the kinds of things that we're easing. Every single Albertan and their health and their life is absolutely important. And that's true not just protecting people against the spread of COVID-19, but the health of every Albertan in the broadest sense is important. And we know that the restrictions that we have needed to have in place over the past 16 months in different degrees, that those restrictions have come with their own health impacts. And so the choice to move forward at the pace based on the overall population level of protection from vaccine is again made based on the knowledge that we need to not only mitigate the health impacts of COVID-19, but we need to mitigate the health impacts that the restrictions have had. We have been working for many months with different partner groups to make sure that we are reaching out to different groups of Albertans where there may be barriers to accessing vaccine, whether that's logistics, whether that's information, whether that's language barriers. We will continue to do so over the summer. And so again, I want to be clear that no one Albertan or group of Albertans' lives are less or more valuable than others, but this is about balancing all of those health impacts, continuing to do the work to offer vaccine, to make sure that that level of protection is available to everyone no matter where they live, no matter their situation, but at the same time recognizing that if we keep restrictions in place longer than they are necessary, we are damaging health in other ways. And again, that balance is what is absolutely critical.
All right, we'll go to the next question in the queue. Catherine Kukoski, AB Today.
Hi, thanks for taking my question. Since this is your last update, I figured I'd look to the future. As this disease is considered more endemic and less of a pandemic, I'm wondering how that changes the work of you and your team. Will you be looking at things like long COVID or mental health impacts? What changes for you as we shift from that pandemic to endemic response?
This is the question that is one of the biggest areas of focus right now, of course, because first of all, it's important to remember that COVID-19 is not the only health threat that Albertans are facing. There are other significant issues that Albertans are facing, and in terms of some of the specific infectious disease risks, such as syphilis that hasn't gone away, that continues to be a threat. Some of the non-infectious risks, you've mentioned mental health. We know that substance use disorder, those are all things that need attention and certainly have been being worked on over the past 16 months. However, COVID-19 from the public health team's perspective has taken the majority of our time. And as we look forward, we need to be able to look at COVID-19 as a vaccine preventable disease. We manage many vaccine preventable diseases in public health, and needing to integrate our response into a sustainable approach going forward so that we have the capacity to look at COVID-19 as one of many infectious diseases rather than the dominant risk that we've had to navigate, again, prior to the introduction of highly effective vaccines. So again, it's about integration, it's about looking at a multitude of other issues that need our attention, and again, that concept of the whole health of Albertans and really looking at that big picture.
And as if you anticipated my next question, Bill 66 in this past session gave more powers for monitoring and planning for both chronic diseases and preventable injuries. Wondering if there's any of that that's on your radar right now that sort of got pushed to the sidelines because of COVID.
It's interesting as we look at the historical data on the causes of death in Alberta, and particularly the causes of the potential years of life lost. And that particular statistic is one that's used to find out which causes of death are taking away the biggest impact on all of us collectively by deaths that happen at a younger age, especially preventable deaths. And you mentioned injury prevention. Certainly injuries are a significant challenge, and working on injury prevention is one area that is important. Of course, again, there are many health topics that are important to look at from a prevention aspect as well as a health promotion aspect, and enabling Albertans to access their full health potential as much as possible. I would say that part of the work over the next several months is, again, the integration of COVID-19. We need to continue to be able to monitor and respond, but then looking at our current landscape and those priorities and what are those things that we need to spend the most time on addressing. And that prioritization work is yet to unfold, but again, I've just mentioned some of those specific concerns that have been a challenge in the past and that continue to impact Albertans and take away the potential of our population.
All right, we'll go to the phone now. Operator, could you put through the next caller, please?
Yes, first is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. I'm hoping you can be a bit more specific about guidance for parents of kids under 12. Can you give some examples of activities that they should avoid until they are vaccinated?
I wish that I could give a very simple set of rules that all parents could follow. Unfortunately, again, it really is going to come down to risk assessments for those parents. Certainly, again, as my family and I navigate the coming months with children under 12, we are looking at the kinds of activities that will provide the most benefit while we're weighing out our risk tolerance, looking at things like choosing outdoor activities where possible, knowing that outdoors has less transmission risk than indoors. But I think it's really important, again, for parents and for those younger kids to be thinking about what not just the COVID risks, but the risks of declining activities are. Again, we need to be able to integrate COVID-19 and think about those risks and benefits in a holistic way. It's tough. There's no one single answer that's going to be true for every single family. However, again, COVID-19 is not the only risk that's facing our children, and we know that over the past 16 months, that the impact of the pandemic, the impact of the restrictions on children has been significant. There's some data that indicates that physical activity has gone down. Certainly, there has been an impact on children's ability to socialize, spend time with friends. And so each family really needs to understand what their child's needs are. If their child has specific health conditions that may mean that an infection would have a greater impact on them, those are the kinds of factors they'll need to weigh as they make those decisions that are right for their family. But there's no one single set of rules that will be accurate and appropriate for every single context.
Kevin, is there a follow-up question?
Yes. So, Dr. Hinshaw, you said that it's different for every family. So I guess I'm wondering about your family. What are some of the things that you and your children are either not going to do until they're vaccinated or are going to do despite maybe some of your concerns?
Sure. Some of the principles, again, we're using is looking where we have options at engaging in outdoor activities preferentially, thinking about timing of when we might be visiting family, older family members, and thinking about timing of perhaps if the children are doing something with a group of new people that aren't part of our household circle, that having that happen several weeks before we have the family visit. So those are some of the things that we're doing in terms of our family's navigation of risk. But that doesn't mean that they're right for everyone. And again, using the principles that we've used over the past 16 months, knowing the kinds of activities that have a higher risk of transmission, the kinds that have a lower risk, and again, making the decisions that are right for each family. It's certainly not easy, and I understand for all of us, there's a period of uncertainty and anxiety as we move into this next phase. However, again, it's really important to think about COVID as one risk of many risks that need to be navigated as an integrated whole rather than the one risk that dominates all others, particularly for kids who in general have an extremely low risk of severe outcomes.
Operator, could you put through the next caller, please?
Next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. Thanks for taking my question for last time. Can you please be specific about the threshold that Alberta would have to go over if cases start to rise again that would trigger reinstating some measures? We had some really specific benchmarks for opening up, but what are the benchmarks for the other direction?
The advantage that we have in Alberta with the high first dose uptake and the rapidly increasing second dose uptake is that the case counts that we may see don't necessarily need to drive action like they previously did. And the reason for that is that we know that vaccines are highly protective against infection and even more protective against severe outcomes. So when we've seen the data from the UK, for example, we know that in the UK cases have started to increase, particularly with the Delta variant of SARS-CoV-2, which causes COVID-19. We've seen hospitalizations not rising in the same way that they've done in previous waves. And in Alberta, we've had the opportunity and the advantage of offering vaccine to all age groups 12 and over in a significant way for over a month at this point. Whereas in the UK, when they saw the Delta variant begin to spread, they hadn't yet been able to offer vaccine to some of those younger age groups. So if we do see cases start to rise in Alberta, that doesn't necessarily mean that we're going to see severe outcomes rise in the same way. And without that correlation, it would not be appropriate to use those case counts with exactly the same thresholds that we'd used previously, because again, we know that COVID-19 is one risk of many, and we need to use public health measures only if we see a significant system-wide impact, which vaccines, by all accounts, even looking at the UK data, are going to be a significant mitigating factor. So we will be looking at all of the indicators, but particularly looking at impacts on severe outcomes. And if we start to see those impacts rise, then that will be the biggest concern. But cases alone, again, are not going to be something that we need to respond to in the same way, because we now have a much higher level of protection with vaccines.
Audrey, is there a follow-up question?
Yes, please. I'm sure vacation is on the mind of many Albertans. So what is your advice to Albertans who want to travel elsewhere in Canada and Canadians who want to travel to Alberta?
When we're thinking about potentially traveling this summer as vaccination levels rise across the country, there are a couple of things that are important. One is to make sure that you know what the rules are in the place that you're visiting. So there are some provinces in Canada that continue to require quarantine if people are coming to that province from other areas of the country. And sometimes that will depend on immunization status. So make sure before planning a trip that you know what the requirements are. Being immunized before traveling is strongly recommended, whether or not the destination requires immunization to not have quarantine, because having that protection of immunization, aiming to have the second dose at least 2 weeks before travel plans are made, is going to be one of the greatest protective choices that people can make before they go to another part of the country and potentially, again, interact with others outside their typical circle. The other thing that's important, especially as people are considering whether they may want to come to Alberta and others considering leaving Alberta to go elsewhere, is using the same kinds of judgments and precautions that you would use typically at home. So there is still some COVID-19 risk in most places across the country. Some places have more than others. And so thinking about that as you're planning your trip, there's data available online, and considering, again, given circumstances, risk factors, the kinds of protective measures that people want to continue to take those whatever part of the country you're in, and to be respectful of those around you.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is Don Brave with the Calgary Herald. Go ahead, Don.
Dr. Hinshaw, first, I think a lot of us are going to miss you. I think the Alberta government website will miss you, or at least miss your ratings, because they'll go down. I just want to ask you, what would bring you back? What level or what condition with COVID would bring you back to this podium in the future? Because it sounds like your departure is rather definitive. So I guess we have to hope we don't see you back in that sense. But what would it take?
So I think that there would be things that would prompt an availability that could be good news stories, as well as times where there could be some concern. So in terms of the the level of concern. Certainly if we did see cases and hospitalizations rising, and it was important to provide an update on the context and what was happening. We don't have a specific cutoff, but of course the opportunity to provide an update to Albertans is still there. It's just that it won't be on a regularly scheduled basis. But on the good news side of things, there are some restrictions that are remaining in place in stage 3. And as we go forward, as we evaluate, monitor, and learn more about what happens after stage 3, there will be opportunities in the future to be able to lift some of those restrictions and requirements. And so there may be good news stories that could potentially prompt a return to the podium. So those are the kinds of examples, again, that may necessitate an availability, but it's just that it won't be regularly scheduled going forward.
Don, is there a follow-up question?
Yes, there's political language we're hearing that the pandemic is basically done. It's over, and we're just out to yeehaw when Stampede starts and all the rest. Is it? What risks do you see? I mean, are we really through this?
COVID-19 is not over in the sense that we still have disease, we still have variants of concern, and we still need to watch to see how those variants intersect with the high and increasing levels of vaccine coverage that we have. I think one of the things that's really, really important for Albertans to understand over the course of the summer is now is the perfect time to access the protection that vaccines provide. We saw last year in the summer that the numbers remained low, that there's a seasonal component to spread. And so I think we should all anticipate that at some point we will see increasing numbers. The way to prevent those numbers from having a significant impact is to have as many of us as possible access that protection that vaccine offers and be a part of protecting our communities. Those are the kinds of things that we will continue to work on through the summer, that we will continue to ensure that Albertans have access that's low barrier to vaccine, that information is available, so that we can enter the fall with the best possible level of protection. The other thing, of course, that's really important to keep in mind going forward is that COVID-19, as vaccine levels increase, becomes a more manageable risk at a population level. And I think that's a shift that is going to be a challenging one, again, over the coming months as we see that vaccine level rise, that protection level increase. We need to be able to integrate, as I was saying earlier, how we think about COVID-19 in an individual and collective way as one risk among many others, because when we focus on COVID-19, as we have needed to do before we had vaccine coverage, when we focus on it in a dominant way, it takes away the attention and resources that we also need to be using for other health issues. So COVID-19 remains a challenge that we need to respond to, but over the next many months, the other task that we have is to try to integrate that amongst all of the other health risks so that we don't inadvertently cause other problems. So that we have those two challenges to meet that we'll need to bring together over the coming months.
Operator, could you put through our second last caller, please?
Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. Just want to say thanks for making yourself available to take our questions all these long months. My question today is about contact tracing, and I'm wondering now that case numbers are down, what the plans are for that. Are people being who were recruited, are they being laid off or redeployed back to their normal jobs? And then if that is the plan, where does that leave us in terms of numbers with the contacting tracing team and ability to respond if our case numbers start to rise again?
We're working on forward planning and what that looks like for things like contact tracing and how we will be managing COVID-19, not just over the next month or two, but over the coming influenza and other respiratory virus season. So right now, the contact tracers are not being laid off. There's workforce, of course, that's there. Some of that workforce is able to be redeployed to other areas while the demands are lower for contact tracing. And we're working with Alberta Health Services to plan forward so that we can create the resilience that we need as we, again, think about what this transition will look like from responding to COVID-19 before we had vaccines and when we had only early vaccine protection to what that will look like once we have a significant level of 2-dose protection in the population. So there may be some changes in terms of what we require in contact tracing, but in the short term, we are keeping the system intact, making sure that we're watching closely over the next month as we see the impacts of stage 3, and then some of those longer term strategic decisions, again, depending on what we see unfold, both here and in other places around the world and across the country.
Jen, is there a follow-up question?
Yeah, thanks. I just wonder about the outbreak of Delta in Calgary at the hospitals. We've got an outbreak involving Delta now at Peter Lougheed. Can you give us an update on that and what's known about it and what your level of concern is that, that we are still seeing this and that there are these Delta outbreaks related happening in hospitals even as we open up? What's your level of concern and what can be done to prevent these or slow them down as we move ahead?
The outbreak at the Peter Lougheed, I don't have the updated numbers on that, but certainly it's something that we're watching closely. What we know is that there were cases in that outbreak, some in people who had been fully immunized, some in people who had 1 dose, and some in those who had no immunization at all. It was a mix. And one of the things that is important, again, as we go forward is knowing that we are retaining the protective measures in acute care as one of the most vulnerable environments, such as requiring masking in an ongoing way, because it's some of those kinds of protective measures that we need to keep in place, particularly as we have seen some transmission of the Delta variant, again, inside a hospital setting and with people who had received 2 doses of vaccine. It's important to put that particular outbreak in the larger context, though, and to see places like the UK where they have had significant transmission of Delta variant, that it's still a very small percentage of their overall numbers that are occurring in people who have had vaccine, especially 2 doses. The majority of cases continue to occur in people who have not had vaccine. And in our own data, although we have many fewer Delta cases, again, we are seeing the majority of cases occurring in those who have no vaccine, and in a smaller number those who have had a single dose. So it's something we're watching very, very closely. We know from the UK that even a single dose still provides a high level of protection against hospitalization, but 2 doses are even better. And so we need to be, as we are, encouraging people to get their 2nd dose as soon as they can, to again provide those layers of protection, while at the same time we continue some of these other measures like continuous masking, infection control protocols that have been in place in hospitals for many months, while we learn what happens as we move into stage 3.
Jen, AHS will follow up offline with the latest numbers from PLC. Operator, could you put through our final caller, please?
Final question is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Doctor, and thanks again for all your efforts on this file over the many months. What do you say to people, and I'm thinking about this as I hear some of the questions, the people, not because of any personal vulnerabilities that they have, but just because that's the feeling they have, that are just seem to be unwilling to accept the good news, unwilling to accept yes for an answer, unwilling to accept the fact there's 61 cases where there used to be over 2,000 daily cases. What do you tell those people who are still grim and still in the darkness at a time like this when the province is about to open up, as are other provinces, as are other countries, and the vaccination rates continue to go up? What do you tell them to sort of How do you deal with those people?
I think it's difficult when we've been in a particular environment for 16 months, where I've been at this podium 245 times, encouraging people to stay away from others, to wear a mask, to make sure that all of the protocols are followed. I think we've all adopted habits that help us feel safe and have kept us safe, that these are the kinds of measures that have gotten us through to this point. And this next several months is absolutely a transition time. So what I would say to people who are feeling nervous, who are wondering what's going to happen, will Delta spread? Will this opening cause COVID-19 to surge again? I would say, first of all, that it's okay to experience a multitude of emotions. It's okay to be worried and anxious and excited, and sometimes all at the same time. And what we all need to do is again, watch the data. We need to look closely at what we're seeing from other countries to know that vaccines are incredibly powerful to continue. I think it's very reasonable over the next little while for people to continue to take some of the precautions that they're used to as they think about how to engage in some activities that are now possible that haven't been for a long time. And ultimately, I think what's going to be important over this next little while is that we can try to be compassionate with each other as we're coming at this from different perspectives, and to support each other to take the precautions that we need to, particularly until everyone has the chance to receive the protection of a second dose. I mentioned earlier about 40% of Albertans 12 and older have had that opportunity, but many haven't yet. And so again, it's reasonable to support each other through to that next time point where everyone who wants 2 doses has been able to access it, and we've reached that higher level of protection. So again, there's no one right path that's going to be correct for everyone, but we can see the power of vaccines. We can see it in our own data. We can see it in the data from other countries. But we have the privilege in Canada of being in some ways at the forefront of vaccine protection. And so we are one of the first locations that's able to make some of these decisions. And that, of course, means that we will be watching closely, but people need to be supporting each other again as we're moving back into activities that we haven't done for a while.
Rick, is there a follow-up question?
Yes, throughout this pandemic, especially at periods of crisis, particular crisis, you spoke about the light at the end of the tunnel, and people should focus on that. That you have to have restrictions, you have to have this or that, but there is a light at the end of the tunnel. Today, on your last scheduled live update, how close are we to the light at the end of the tunnel? How close are we to the end of the tunnel now compared to where we were through all those months where you mentioned and used that image in your explanations?
Well, the tunnel of needing to have a broad set of public health restrictions to be able to manage the risk of COVID-19, that particular tunnel is coming to an end on Thursday. The transition period, so to speak, I think again over the next few months, we'll still be building our immunity through vaccine. We'll still be navigating that transition. And so again, COVID-19 isn't over, and people need to again be thinking about that as they make their decisions. But the good news that we have right now is that vaccines are highly effective, that we have a significant supply, we have a greater supply than we had anticipated earlier this year, and that we have enough to offer all Albertans who want that second dose. They should be able to get their second dose within the coming month, and that's fantastic news. So again, I think the worst of the tunnel has ended. We're still in a transition period. And so the best thing we can do, I think, in this transition period is to support each other as we move through that space at our own pace.
Thank you all for joining us. That concludes today's COVID-19 media availability. Have a safe evening.